everyone, good afternoon. I hope you're all having a great week so far. Um, for those of you who I have not met yet, my name is Jenny Snell and I'm the Chief Exec of the Young Women's Movement. And it's an absolute delight to welcome you all to the launch of our EmBody to EmPower resource today. So a huge thank you for joining us and supporting the work of our team and all the young women that have been involved. We are really excited about this, and in a few minutes we're going to hear from three speakers who will tell you more about the research that informed it, the resource itself and the co-design process that we went through with young women. But just to kick off, a couple of wee housekeeping pieces. This event, as you've just seen, is being recorded. So for those who don't want to be kind of appearing on screen, please do just keep your camera and your mic off. Also, if you feel free to kind of drop off just now, if that's easier, and give us an email and we can share the recording with you afterwards. If you do not want to appear in the recording, but you want to ask a question during the question and answer session, do just pop a wee message in the chat to us and either Elena or myself will pick it up. We can ask the question for you, or we can pause the recording so that you can ask your question verbally and then we can restart the recording again. So just keep in touch with us on the chat. If you can keep your mic switched off during the presentations, that would be fab. Just as we are recording this, it would be fab not to have any background noise. Feel free to keep your cameras off if you want, or on, whatever you feel most comfortable with. Aware we're doing this over lunchtime, so if you are munching your scran in the background, please do feel free to keep your cameras off. That's absolutely fine. And like I said, there will be some time at the end for a Q&A session with the three speakers, so do take a wee note of any questions as we're going through the presentations. And if anybody is having any difficulties with tech or you get kicked out of the call at any point, please give Elena, our events and partnerships lead, a wee shout. She has put her details in the chat for you if you have any issues. Brilliant. So that's it for housekeeping. So today we are really excited to launch our EmBody to EmPower resource for young women and girls. This resource is a direct result of our Status of Young Women in Scotland research report from 2022-2023. And that was a young women-led participatory research project that heard from just under 1,000 young women in Scotland about their experiences of accessing healthcare. So we'll be hearing a quick overview of those findings in a few minutes, but what the research highlighted was the experiences that young women had throughout the whole journey of accessing healthcare and what changes need to be made at a kind of systemic and local level to ensure that young women can access the healthcare that they both need and deserve. So it's really, for me, important for us to recognise that healthcare, as it is for other systems and services in society, was not built for women. It wasn't built with women in mind. The system is flawed in terms of women's experiences, and there's a lot of work to do in terms of changing those kind of service design system pieces. But there is a lot of work taking place across healthcare, across government, across third sector and civil society to try and change that system. But given the immense pressure on the NHS right now in a pre-pandemic context, it was recognised that those larger kind of system change pieces are going to take time. They require investment, they'll require further research. And that's not to say we shouldn't be working on those. We absolutely 100% should. And at the Young Women's Movement, we will continually be pushing for those policy, system and service design changes through our research work, through our policy and influencing, and through our co-design work. However, what we identified was young women don't have the luxury of time. They needed something now to support them to access healthcare in the immediate sense, and that is where EmBody to EmPower came from. So today we are really delighted that we've got three speakers that you're going to hear from. Our research and policy lead, Dr. Rebecca Mason, is going to give us an overview of the Status of Young Women in Scotland findings. We're then going to hear from Lou Chauvin on our process and co-design project. So Lou is our collective voice and action coordinator, and she led the work with the young women. And then we're going to hear from Eleanor, who is a participant on the co-design group, and she is going to share more about the resource itself, and then we'll have time for questions at the end. So that is it from me at the moment. I'm going to pass over to Rebecca to kick off with the status findings.
Thanks so much, Jenny. So as you've just heard, the EmBody to EmPower resource was made possible by our large-scale research project on young women's access to healthcare in Scotland. Next slide, please. So the Status of Young Women in Scotland 2022 to 2023 Experiences of Accessing Healthcare report shines a light on young women's experiences throughout the journey of accessing healthcare and what needs to change to support them to access the healthcare in Scotland that they need and that they deserve. Next slide, please. So the research engaged with over 900 young women and people of marginalised genders aged 16 to 30 across Scotland, with representation from every Scottish local authority and from all of the target ages, exploring a wide range of findings on issues across the access to healthcare journey. So the research and policy team hosted focus group discussions around accessing healthcare with young people aged 16 to 30, with young people who were disabled or who have long-term health conditions, who live rurally, who are from ethnic minority backgrounds, and those whose weight impacts their access to healthcare. So these groups individually and collectively explored barriers to accessing healthcare, how negative experiences can impact future access, what makes a good healthcare experience, and what needs to change for all young women to better access healthcare across Scotland. Next slide, please. So overall, the report found that young women in Scotland struggle to access the healthcare that they need and deserve. Across everything we explored within experiences of accessing healthcare, young women told us that they feel as if they are not taken seriously in healthcare settings, that they are often dismissed and their experiences are minimised. Many told us that they feel patronised and not believed by healthcare professionals. Young women were then left with no further offer of support or follow-up. So from registering with a medical centre, a GP or a dentist to make appointments, to experiences of being treated by and interacting with healthcare professionals, accessing healthcare is often a difficult journey for young women. Next slide, please. And engaging with these varied health services was challenging for many young women. For example, many young women felt like talking to a GP about their mental health was pointless because they understood how long it would take, how long they would have to wait to get referrals. Some shared how difficult it was to get an appointment in the first place. Other young women reported that the medical centre in their local area was no longer open for new registrations, or that calling early in the morning was simply not an option for them due to work, school, or caring responsibilities. Many young women have turned to private healthcare due to long wait times. Around 43% of our survey respondents who accessed healthcare privately at some point in their lifetime, with 62% of these people noting that they had done so because of wait times. And this left some women feeling financially vulnerable due to the associated costs. Young women frequently reported feeling like their mental health concerns were dismissed by healthcare professionals. Equally, young women described experiences of presenting with physical symptoms, and healthcare professionals would suggest poor mental health was the cause, but without offering tangible next steps for either. Next slide, please. So one survey respondent said, and I quote, "I tried to access mental health care so many times before I was finally able to see a specialist. It took years for me to get life-saving healthcare and medication. The first time I went to see my GP, despite pretty severe symptoms, I was told to do a worksheet and try not to think about it. I was angry thinking about how much easier my life could have been if I'd been taken seriously when I was a teenager, especially because I don't think they would have reacted that way if I hadn't been a brown teenage girl." So young women are left feeling like they have not been taken seriously and they have no pathway to healing. Commonly for young women presenting with any symptoms, mental or physical, medical professionals would suggest hormonal or menstrual issues were the likely cause. The medical profession needs to practice anti-racism, dismantle ableism, and operate intersectionally to consider the experiences of all young women and people of marginalised genders in relation to their diverse needs and circumstances. Next slide, please. So what did young women ask for? The report recommended that diverse changes were needed to improve young women's access to healthcare. Being listened to, heard, believed, and validated were by far the most important features of a positive healthcare experience. And the report suggested that healthcare professionals could show more empathy and genuine care when dealing with young women in a healthcare setting. The report also recommended improving the accessibility of appointment booking and addressing issues surrounding limited NHS resources. So many young women we engaged with had a story about being dismissed in a healthcare setting where they had come away from an interaction with a medical professional feeling like they had not been heard. And this results in young women having to push and push to access the healthcare that they need and deserve. And this is a responsibility which should not lie upon them. Young women want to be seen, heard, listened to, and validated. They want healthcare professionals to take them seriously. They no longer want to experience medical misogyny or gaslighting in healthcare settings. Young women and people of marginalised genders need and deserve to feel safe to access timely care, especially in relation to reproductive and sexual health services, gender-affirming healthcare, and mental health support. So young women asked for better access to information and signposting for bespoke services. They want better education for themselves around accessing healthcare, and they want to know their rights and about how conditions might affect them differently, acknowledging that women's health is not widely discussed, nor is it widely researched. So I'm really delighted to be here today to launch the EmBody to EmPower resource, and I would like to thank the young women who took the time out of their busy schedules to co-design such a wonderful resource that will hopefully help young women across Scotland advocate for themselves and access the healthcare they desperately need and deserve. Thank you.
Thank you, Rebecca. That was great and hopefully gave everybody a bit of a flavour as to some of the findings that came out of the status of young women in Scotland research. As I said earlier, the Young Women's Movement will be continuing our influence and work on the theme of young women in health this year, and we'll be working to kind of push forward those recommendations that came out of the report. Now we are going to pass over to Lou, who is going to share more about the project itself.
Yes, hi everyone. So I'm Lou and I'm the Collective Voice and Action Coordinator at the Young Women's Movement. I co-facilitated the EmBody to EmPower project and worked with the young women who took part. And I'm going to talk about how the project came about, what our approach was, and then I will pass it over to Eleanor, who will present the resources. Next slide, please. Thank you. So as Rebecca just explained, the report unveiled a wide range of findings, one of them being that young women often have to self-advocate in healthcare settings, but also that there was a need for better education for young women around accessing healthcare. So based on this important research, the next step for us was to address some of these issues, and we had the idea of co-designing a resource for young women by young women to support them to feel confident and advocate for themselves in healthcare settings. We also just want to note that we think that this is not enough and there is still a need for systematic change, but that this resource is our contribution and an attempt to fill in gaps of education and information. So for the program, we recruited 14 young women and people of marginalised genders aged 16 to 30 across Scotland for this project. We recruited them from social media call-outs, and some of them were participants of our focus groups for the report, and young women that we had also engaged with us, that had engaged with us in the past. We worked over 4 sessions of 2 hours in the evening between June and September last year. And the sessions were co-facilitated by us at the Young Women's Movement and the talented creative consultant Zoe Patterson, who co-designed the artistic and creative side of the resources, which you will see in a minute. And she worked with the young women and based herself with what they thought was more relevant and suitable for the resource. The idea of this program was to create a safe feminist learning space for young women where they could share and reflect on their lived experiences of accessing healthcare. Together, throughout the sessions, participants identified areas of the healthcare journey where they wished they knew more or what they wished they could tell their peers across Scotland. And the content of the EmBody to EmPower resources encompasses all the discussions that we had as a group during the sessions, and aims to address issues identified by the young women throughout the various activities that we had during the sessions. Next slide, please. So our goals here were to amplify and empower young women's voices and to be proactive in removing obstacles to young women's participation. And for that, we followed a meaningful participation approach, which is about meeting young women where they're at and making it as accessible as possible to contribute, especially to important discussions and changes that are relevant to their lived experiences. So for that, we paid attention to inclusivity and ensured that everyone's voices was heard and that everyone could participate to accessible sessions. We made sure that the sessions were safe and respectful, and we wanted to create an environment that offers genuine opportunities to our young women. And we also offered vouchers for each session attended by participants. And sessions were voluntary. Participants could contribute as much or as little as they wanted, and they could withdraw at any point. The priority was really to create an environment and opportunities to engage with something that they have lived experience with, of, and want to advocate for. So in practice, we gave participants full autonomy over the content, format, creativity, and distribution of the resources so that our practice aligns with their own experiences and reflections, and so that it helps those who will receive this resource. We collected feedback throughout the project to ensure that the resource was heading in the right direction and that we were using the space effectively to be able to adapt to what the young women wanted to talk about and thought would be more relevant for that resource. The young women also reviewed the drafts of the resources so that it aligns with what they had in mind, and so that we made sure that we interpreted our sessions correctly. And they also met with other women who are health advocates from the Northern Highland Women's Wellbeing Hub, and they also kindly accepted to review our resources and discuss to the young women about health advocacy, drawing on their professional and personal experiences. Young women who took part were also given further involvement opportunities once the sessions had been completed. We wanted it to be more of a continuous process rather than a one-off event. If they wanted to keep getting involved, and they had the opportunity to give feedback on distribution or to get involved in like writing a blog or promotion, or like Eleanor today. So overall, we are very pleased of the result, and the feedback from participants has been very positive and highlighted that the program has been an empowering process for the young women involved. We are incredibly proud of this resource and of the participants who stepped forward and shared their lived experiences. Participants have told us that they got to develop multiple skills, including communication, working with others, setting and achieving goals, and that most importantly, the young women involved highlighted how the project has enabled them to get a better understanding of healthcare issues in Scotland and to find joy in being part of positive change, advocating for young women's needs in healthcare settings. We are also excited about the impact that the resources will have on young women and people of marginalised genders across Scotland. And we hope that the resources will provide useful tools to better equip them in their healthcare journey. But we also hope that the resource will highlight the importance of young women being heard, listened to, and feeling safe and validated in healthcare settings. So I will now pass over to Eleanor, who will present the amazing resources that she has co-designed along with the other participants of the EmBody to EmPower project.
Hi everyone. Yeah, my name's Eleanor, and as Lou said, I was part of the EmBody to EmPower group. I got involved with the project after seeing a call for volunteers on Instagram. I hadn't been involved with anything with the Young Women's Movement before, so I was really eager to get involved, especially as I have several chronic health conditions and disabilities. So I really wanted to get involved in the project because it sounded like it was going to create something which was going to have some form of positive change. And I really wanted to kind of help use some of my own experiences to hopefully help other people. So as they said, we're going to show you what the group of participants co-designed with the Young Women's Movement over the course of the 4 sessions which we had. The first piece is the digital PDF document, So this is a 15-page document that includes 7 different chapters to help women self-advocate in the healthcare setting. So these include the following. The first being tips on knowing your own body, how to describe your symptoms and what to pay attention to. The second on how to access healthcare. This includes links to services available, the different types of consultation which may be available, for example, in-person appointments or e-consults, how to register with doctors and how to make an appointment. The third is how to prepare for an appointment. So here we included tips on what to bring with you to an appointment, how you might want to prepare some notes, and information on how to keep a symptom diary. The next chapter is on what a positive experience of accessing healthcare could look like. So one example was that you should feel listened to, safe and believed. Here we included quotes from the Young Women's Movement Status Report to help to illustrate this section. And we really wanted to highlight the importance of young women feeling like they were being listened to, heard and believed, as we thought this was really important. Next, the resource also includes how-to guides and examples of questions to ask during medical appointments to help advocate for yourself and access the healthcare that meets your needs. For example, we added suggestions and questions to ask if you're feeling like you're being dismissed or the doctor isn't taking you seriously and you're feeling like things are still unclear. We also included further links here and resources to learn more about the rights we have as patients. And we also included support links and signposting and further reading to other places where young women can access support. This long form document is available on the Young Women's Movement website alongside the plain text version, which can be used with screen readers. The next resource was an A4 fold-out leaflet. It's an accessible condensed version of the longer PDF and contains the main messages of the resource, the description of what a positive experience of accessing healthcare should look like, as well as things to say or ask during an appointment. The printout also has a QR code, which takes people to the long form document online. And the A4 foldout is available on the Young Women's Movement website, and printed copies are also available for order. And the goal of having these physical copies is so that the resources can be distributed across Scotland as widely as possible. We chose this design so that once it was printed out, the resource was easy to pick up and quick for people to read. And if people are interested, they can then scan the QR code and read the full long form document, which contains more of the information and the signposting links. It was also important to us that this resource would be discreet so that people could pick it up and take it home with them quite easily. And the final resource that we developed was stickers. And we really thought that the eye-catching stickers with the illustration and the name of the project on were an effective and quick way to spread the word about the campaign amongst young people. The stickers also feature a QR code that links to the PDF document so that if people don't have time to read the digital or the physical copy but would like to scan and save it for later, they can do so. These stickers are available both online and for order as physical copies. During the design, sorry, got a frog in my throat today. During the co-designing process, we had control over what the resources were going to look like. So with the help of the creative consultant, Zoe Patterson, we came up with the name EmBody to Empower. We really wanted to create a name that would encapsulate the values and the goals for the project, something that would stand out, a name that would kind of recognize all people's voices and for people to stand up for what was right. We also wanted a name that celebrates our expression and knowledge and the rights that we have as young women. And we also chose the color palette and the illustrations. We really wanted a design that would make us feel empowered and that would look welcoming to everyone. Working with Zoe, we went for the soothing pastel colors and the quirky illustrations and a very kind of clean style. And the 3 formats of the resource which we went for in the end were based on what the group felt would be the most suitable and the most effective when trying to reach young people across Scotland. And it was also really important to us that the resource would be accessible for everyone, and we paid particular attention to the font type and the size, and also the colours and the language which were used so that it could be as inclusive as possible, but also thinking about it being inclusive about where and when it could be distributed. When working on this project, the group imagined that it would be really useful to distribute these resources across diverse services and spaces so that it could reach as many young people as possible. We felt that they would fit really well within the healthcare setting, in waiting rooms, support groups, but we also felt like they would work really well in school or higher education settings, community spaces, and other social spaces across Scotland. I really enjoyed working on this project, and it's been really amazing to see the resources come to life, as I feel like we've really created something which can make a really big difference to young people's experiences. It was a real honour to get to work with the other young women from across Scotland on the project, and I really valued being able to collaborate and be part of a team. I really hope that the resource will reach as many young people as possible to try and help them navigate their healthcare and to feel empowered, and most of all to feel like they're not alone and it's not just them, and that there are services out there which can help them. Especially when I reflect on my own experiences of accessing healthcare, I really wish there'd been something like this resource when I was experiencing it. So if anything, I hope that it helps other people not feel so alone. I really hope it empowers young women to feel confident that they know their own body best and they know if something's wrong, and to help them to advocate and access the support that they need. Thank you.
Thank you so much, Eleanor, for sharing the resource, and a massive thank you for all your work supporting the co-design of this as well. I'm always absolutely blown away at the passion and the energy that young women bring to our movement. It's phenomenal, and we couldn't do the work that we do without you. So I hope that you and the rest of the co-design group are incredibly proud of everything that you've achieved, of the resource, and of all the change that it'll create for other young women. It is incredibly powerful stuff. So a huge thank you, and a huge thank you for joining us today to share that as well. Thanks to Lou as well. That was amazing to hear about the co-design process and how this resource all came together. At the Young Women's Movement, all of our work is led by young women for young women. We're completely intersectional, participatory, and use a youth work approach, like Lou said, to ensure that we're best meeting the needs of young women and girls. So all of our research campaigns and programmes are co-designed with those who have lived experience, as we know that it is essential for creating solutions that are authentic, that are relevant, and that are meaningfully informed by young women themselves. We do also work with organisations on commissioned co-design programmes, research and training. So if your organisation is looking to do some young women-led research or a co-design campaign or create resources like EmBody to Empower, then please do get in touch with us for a chat. We're now going to move into our question and answer session with our three speakers. So Lou, Rebecca and Eleanor are going to hang around and answer any questions that you have about the resources or the co-design process or the research. So I'll give everyone a few minutes to gather their thoughts. Please feel free to put your hand up to ask a question, or you can put a question in the chat and I can ask it for you, whatever feels best and most comfortable for you. But to kick off, we've already had a question in the chat, and it was one that I'm sure a lot of people are thinking about. Lou, could you please share with everyone how they can order any physical copies of the resource, please?
Yeah, so you can order physical copies of the leaflet, the fold-out leaflet, and the stickers using the order form. There is a link. There will be a link in the chat, and there is the QR code there. The link is also on our website, and you can order a pack of 50 leaflets or a pack of 20 stickers for free. If we get more orders than what we have printed, there will be a wait list, and we will ship them in the next couple of weeks. We are also quite keen to receive feedback on the resources. So there is another form that takes 1 minute to fill in once you have had a read through the resources. So yeah, much appreciated.
Thank you, Lou. And Elena has now popped the order form in the chat, so please do feel free to use that if you're looking for any physical copies. Is there any questions from anybody that's in the room for Lou, Eleanor, or Rebecca? I think we're good.
Sorry, I think Agnes is trying to ask a question, but she's on mute. I'm just going to unmute her.
Perfect. Thanks, Eleanor.
Two, yeah. I'll unmute.
We can hear you now, Agnes.
Okay, I was just going to say, commending the co-designing, and I think it's amazing to write down everything that you want to speak to the doctor about and get all your points across, because lots of times doctors and the professionals are very dismissive. And that sometimes can, you know, when you're trying to get your voice heard, make you less confident. And they have the ability to do that, I know. But I'm part of a families group, and I'm also doing a group. It's an action group, and I'm doing a group called In the Know, because it's just blows me away the amount of people that just don't know what their rights are, how they should get their voice heard, what action they should take if they're not happy. All those procedures are in their human rights and their carers' rights. It's just absolutely everything. So this is a great thing for young people to be aware and get the confidence of what their needs are, and just speak up, get their voice heard, and get validated, because it's your rights. So I commend the young people for doing that.
Thank you so much, Agnes. Yeah, it's been a great process, and I'm very excited. I'm sure the young women are as well, as to where this is going to go next. So it'll be great to have all of you supporting that process as well. So thank you so much. There has been another wee question in the chat. So Lou, I'm going to come back to you on this one. It's, do you come out and speak to schools and groups of young people about this?
What we have not done so yet for now. The distribution of the resources is mainly this event, and then we'll do some social media promotion as well. And I think we're pretty open for any suggestions and any relevant context that we can have for the future the resources.
I can have another question.
Yeah, of course.
You said about the schools and the higher education, and I think that's where the importance lies. I just came from a neurodiversity course there, and where would you sit with the neurodiversity on that, making them aware of their rights and getting their voices heard, when a lot of the times they're masking? Do you have anything on neurodiversity?
Yes, so Rebecca, I'm going to come to either you or Saffron on the work that was done as part of the research and the findings that came out specifically on neurodiversity and status, if that's okay.
Yeah, is Saffron there? I think she would know more than that than me.
Hello, yes, I'm here. Off the top of my head, there is definitely some in the report about neurodiversity, but it came up quite a lot when we were talking to the focus groups about it. There were quite a few young people who talked about ADHD and needs like that. Particularly, they were concerned about waiting lists to get diagnosed for things like that. These could be quite extremely long. And a lot of young people found that even when they were putting these needs across, they couldn't get the kind of support from the doctors to justify getting the further appointments. Sometimes that was quite difficult for them. So in terms of a resource to support that, I don't know if this came up in the groups, Lou, but it would be something that's really interesting to look at in the future, I think, because it's something that's becoming more clearly there is a need to support this. So I think, I don't know if did it come up, Lou?
Well, especially with dyslexia.
Yeah.
I mean, they don't in the colleges. They don't have any of that training, and in the schools, I think it's just coming. We were with Eclipse, who is a funded group, and I think they're trying to do a lot of good work. So it might be an idea to hook up with them, and they've addressed the young person's ADHD and all the neurodiversity. It was quite interesting actually, and they're keen to talk to other people. I think that would be good for yourselves.
Absolutely. I think we could definitely follow up with that. And Eleanor and Lou, I'm not sure if there's anything that either of you wanted to share from some of the co-design sessions that came up in reference to neurodiversity and accessibility and inclusion. I know that inclusion is a massive part of everything that we do, and all of our resources are built with accessibility in mind in terms of how they operate with screen readers and how colours contrast. But is there anything else, Lou or Eleanor, you'd like to share from the groups?
I think Eleanor would probably can maybe add more, but it's definitely something that we discussed as a group, and it's something that the group was very well aware of and definitely wanted to like address also through the resources. And we had a lot of the sessions were discussion based, and we had some activities, but it was mainly about like the sharing of like experiences and knowledge and resources and stuff like that. So it definitely like came up multiple times. I don't know if Eleanor wants to add a bit more to that.
Well, there's
Yeah.
a lot of things for independent living as well for the neurodiverse. So there's a lot of things available to them that even a mother that was there today didn't know. Of course, that's a certain age. I think it's over 16, but it's still something, you know, it could get them digitally included if they need a certain type of digital laptop or something like that.
Eleanor, were you going to come in there with something?
Yeah, I was just going to say, really echo what Lou said. We were very kind of conscious in the development process of it being as inclusive as possible. People did kind of share their own experiences, and we were very conscious of the fact we needed to make the format, the font accessible, and that we needed a version that would be accessible with screen readers in particular. And also, you know, the color palette, that it wouldn't be something that was going to be really difficult to read. We tried to pick a palette where the colors would make the font as legible as possible.
Mm-hmm.
Great. Thanks so much, Eleanor, and thanks, Agnes. That's a really important question. So that's definitely given us a lot of food for thought in terms of how we continue to make sure inclusion is part of everything that we do, but also how we disseminate it. On that, there is another question in the chat. Lou, I'm going to come to you on this one. So there's some lovely comments about how fantastic the resources are, which is lovely to see. Thank you for sharing all those. But there's a question about next steps for disseminating and sharing the resources. So would you like to share a little bit more about our social media launch and then next steps after that?
Yeah, so like I said, I think the main step after our social media launch, where we'll be trying to like really reach out to both young people but also professionals, it's to really get people to then place their orders, and then we're really keen on having the physical resources available in many different like spaces, so not just within healthcare settings, but like Eleanor touched on during her presentation, also to reach out groups that are maybe not always like in like higher education or in like waiting rooms and stuff like that. I think there is a question on
Yeah, I
reaching
think
other groups.
communities would benefit.
Yeah.
All community groups. For example, our group, we support the parents of in any level, but they all have children and grandchildren and everything like that, and it would be really helpful for them.
Yeah, there's also been a wee question in the chat, Lou. I think that's what you're going to go on to around reaching out to other groups who find it difficult to access services, for example, refugees.
Yeah, this is something that the young women also discussed a lot in the sessions, because we were wondering just what are the best ways to reach to groups that don't necessarily always talk about like self-advocacy in healthcare and that don't have this information available. So it's definitely, if also anyone has recommendations on that, I think we would be quite keen to connect with them and have a chat about this.
Yeah, there's lots of groups that would it could give you that information, and be happy to have you to go there and do a presentation if that's the case, or something like this on a Zoom.
Mm-hmm.
Brilliant, that would be fantastic. Yeah, we've got some great connections, especially with our work in Glasgow, through our Empowering Pathways course. So we're connected in with a lot of groups like ANISO and Romanolav and the Ukrainian CDT group. So we'll share the resources through all of our kind of current partnerships and connections that we already have that are existing. But if there's any others, like, please do feel free to reach out to us, share in the chat. Do share the resources as well on social media. They have all just launched on LinkedIn, Instagram, Twitter, and Facebook. I think that's all of them. And maybe TikTok, I don't know. So yeah, please do share with them and help us reach as many organisations. If there's people that you think specifically should see them, do feel free to just tag them in that as well, so that we can reach as many organisations as possible. There is another question in the chat. Was there any work done around sharing information on common women's health conditions, educating people about some of the things that they may experience? So yeah, maybe Rebecca, in terms of like the next steps from the research, what work was done as part of the research around sharing information, and what's going to take place next in terms of some of our kind of further work on advocating?
Yeah, so the report primarily focused on the experiences that women had accessing healthcare and the barriers to accessing it. I think the next step that we're going to be focusing on is what happens when women are within the system. And we're currently having some conversations with the Scottish Government to do some specific focused research on sexual and reproductive health and how that affects young women. So we're currently looking at things like access to hormonal contraception or different forms of contraception. We're also doing a bit of work around access to abortion services as well. So I think looking specifically at particular health needs that, that affect women will be part of the next stage of this kind of progressing this research forward. And we're hoping to do more targeted kind of focus groups on those specific issues. I don't know if Saffron, you have anything to add on that, obviously, if you were more involved in the conversations in the early stage. If not, don't worry.
No, I think you've covered that one. Thank you.
And we are also continuing to work alongside the Women's Health Plan team, like Rebecca said as well, in terms of influencing and creating change in those spaces. Rebecca is and Saffron in the research and policy team also respond to policy consultations. So you can find like the responses to our policy consultations that are informed by our kind of youth-led research on our website as well. So we're kind of working on different aspects of policy influencing and kind of co-design work with young women and girls to try and push this out forward. I've just realised, Laurie, that you are on the call and I didn't realise. Is there anything further in terms of a collective voice and action perspective as to how this resource is going to be disseminated that you would like to share?
Hi there, everybody. I'm Laurie Duffy, the Collective Voice and Action Lead for the Young Women's Movement. Obviously, this resource is phenomenal, and Lou, Rebecca, Eleanor, and the rest of the young women have done such an amazing job. But in terms of disseminating the resources further, this is the launch of these resources, so we're really keen to be guided by the community on where they think these resources are best suited and how we can extend them to places, again, like Agnes was saying, that people might not have access to conversations or resources like this. So we're really keen at the very, very kind of beginning of this launch to see how many orders we get on the physical side of the resource, how many people are interested in accessing the resource. Obviously, it is downloadable from our website, but if the feedback that we're getting from the kind of wider community is that this resource is amazing, we would love to see it in certain places, or we would love to, hear you come and speak about it, or, chat more about the project generally, then we're more than happy to work alongside you to see if we can make that work. And we're just really keen for this resource to be shared as far and wide as possible, but utilising this the experiences and the specialities, if that's the word, of organisations who are working and connecting with young women or young people specifically. So like the Vaginismus Network, or like Macmillan Cancer Support, or groups that work primarily with refugees or neurodivergent people. We're keen for those experts to come and to access the resource, and we can support you and distributing that. So we are really excited and keen to be led by people who are the experts of working with these groups specifically, to ensure that this resource can reach as far and wide as possible, being mindful of the fact that a group of young women did create this. So it has got a big heart, a lived experience in it as well. So yeah, thank you so much again.
Thanks so much, Laurie. That was really helpful. Thanks for jumping in. Is there any other questions that people have that they would like to ask anybody at the moment? There's been some great comments in the chat about places that we can connect in with as well. So after this session is over, we'll take that away and we'll get in touch with people directly, and we'll reach out to all those suggestions as well. So thank you so much for dropping those in to the chat. But is there any more questions?
I say no fear. They're only people the same as you. You've got rights. They have got to work with chartered rights and national human rights. So there's things in place that you can challenge. Always challenge, change for the better for these young women, because you're going to be leaders. I really do think it's an amazing thing, and I commend you on it. Please keep it going. Keep it going.
Brilliant. Thanks, Agnes. It's great to hear that feedback. Thank you so much. Awesome. Well, I think if that's the kind of end of the questions, then I think it's time for us to wrap up. So I just want to finish by saying a huge thank you to the team at the Young Women's Movement. Again, it's an absolute pleasure to lead such an empowering and amazing team of women. So thank you for all your work to create this resource, and an especially big massive thank you to the young women themselves for volunteering to be part of the co-design group and putting all their kind of insight and lived experience into this resource. A huge thank you so much for all of you for joining us today. We are incredibly grateful that you've given up your lunch hour to hear about the resources. So please do let your young women and girls that you're known about and you're working with know about the resource. Share it as widely and as far as you can. The links to the social media kind of content has all been put in the chat. Do order physical resources if that would be useful as well. Yeah, please use it within your settings to support young women and girls to advocate. But like Lou said, we would love to hear feedback. So continue to kind of let us know through the feedback form what's working well, what's maybe not working so well, any other recommendations that we can continue with going forward. And also continue to put pressure on the levers of power so that we can work together to build a system in Scotland where young women eventually don't need to advocate for themselves and are taken seriously from the start. So yeah, a huge thank you for joining us today. If you don't already, please do follow us on social media and sign up to our newsletter. We have a lot of other exciting work coming up this year. We work on a number of different topics that are relevant and are issues that are pressing for young women and girls. So do follow along and get in touch with us if you would like to chat to our partnership team. But apart from that, I think unless anyone else has anything to say, that's it from us. Thank you so much and have a great rest of the day.